Hello, everybody. This is Brian Butcher. I apologize for the call previously. I have never had a call where we've had so many people come on at the same time that I've had to use the star 8 feature, which stops the beeping. So I do apologize for that. And as I was going through my presentation, I wasn't able to look at my cell phone where people were texting me madly. So again, I apologize. I'm doing this recording. Basically, so that you can get it on replay. So my name is Brian Butcher. As I mentioned, I've been a pediatrician in Newport News for 16 years. My wife got introduced to the Nerium company about 2.5 years ago. At the time, we were basically an anti-aging skincare company. She loved the products. She saw the vision in the company and signed up as a brand partner, after experiencing the product for a week. The reason that she liked the company so much was because of the simplicity and the fact that there was good scientific research behind things and the fact that the products actually worked. Now, she didn't tell me that she had signed up, and therefore, I had to do research in order to develop a sense that this was the right thing to do. As a pediatrician, my primary role is to take care of people. It's not to go take a product into the office and solicit it. So it was a little bit, scary for me, to think that I could potentially alienate people from doing that. But needless to say, I did research for about 2 to 3 months on the skincare products, and I couldn't find a reason to not help her market them. And so I jumped on board. The following year, I guess it was actually not even a year, it was just a couple of months after, we had joined the company, then the company introduced the body contouring product, which had a little bit more relevance to pediatrics in that, there were kids who had issues with stretch marks or loose skin, or some older teenagers who had problems with cellulite and dimpling. So it was something that I could offer to them for that purpose. But I was still finding a really difficult time seeing what the relevance, of a pediatrician in an anti-aging company was. And then, in April of 2015 at our conference in San Jose, the Mind Enhancement Supplement got introduced. And the Mind Enhancement Supplement really seemed like a complete departure for Nerium, as it didn't relate to skincare at all. But the interesting thing is that skin and the brain are related. When a baby is developing inside the mother, the skin and the brain are both derived from the same, what we call germ layer, which is the ectoderm. So the skin and the brain can each have an impact on the other. And it's also interesting that brain aging starts occurring as soon, as a child is born. And that's just because we have so many environmental factors, that can adversely affect the brain. So, there clearly was a whole lot more relevance of this product, as it pertained to what I did. And especially after we discuss, what the product was meant to take care of, it became absolutely evident that this was a very relevant product for pediatrics. Now, as it was a supplement, I was very excited about the information that I was hearing, but I was also really nervous about it because, as a classically trained pediatrician or any classically trained physician in the U.S., we're not taught to use supplements. We're not taught to use a lot of vitamins. We expect that people will get their vitamins from the foods that they eat, and we're typically only using vitamins if a person has a specific deficit. Needless to say, I met that with a little bit of skepticism because, there have been so many supplements which have come out, which have, marketed themselves to be the next latest and greatest thing. And I was thinking, oh goodness, here we go again. How is this one going to be any better from everything else that's out on the market? But I think that some of my fears were alleviated by the fact, and my skepticism was alleviated by the fact that, first and foremost, Jeff Stock, who is a cell molecular biologist, was at Princeton University, and much of this research on the product and brain aging had been done at Princeton University. Princeton, for the past 11 of 13 years, has been the leading institution of higher learning in the United States, and also it's a leading institution across the globe in terms of the research that it does. And that made me feel a whole lot better. And then actually taking the opportunity to look up Dr. Stock, I went to the Princeton website, I pulled up his profile, I read his biography, and I also saw all the publications that he had published in. And these were reputable journals. And, that's a big thing, in medicine, is that you have to learn to discern. And, people can publish in all sorts of journals. And there are some journals which carry a greater reputation than others. And the ones that he had published in were actually very significant, reputable journals, so that made me feel a whole lot better. So Dr. Stock had basically been studying brain aging for the past 25 years, and his focus was primarily on two proteins, which is the PP2A protein, a regulatory protein, and the tau protein, which is a protein that's involved in microtubule repair. And the tau protein is more specific to the brain, whereas the PP2A can be found in any cell throughout the body. You might have heard about the tau in the news recently, as the tau protein has been very heavily implicated in Alzheimer's disease, and it's also been implicated in concussion. So there is significance to that, and currently, certainly. So the EHT product that he ultimately discovered, he was looking to find a novel product that he would be able to use to modify the tau protein. Now, the tau protein, helps to repair the skeletal structure of the cell. And if a cell experiences some damage, then naturally some of the damage can be to the actual structure of that cell, so that it wouldn't, in a nerve cell, it wouldn't be able to transmit a message properly. And he looked at a variety of natural products in order, before he came across the product that he derived from coffee bean, which is the EHT. Now, EHT, in its chemical name, stands for eicosanoyl 5-hydroxytryptamide. And, coffee has been shown to play a fairly significant role in Alzheimer's disease as well. That's been in the news media as of late. If people drink a certain amount of coffee, it might actually help to push off the development of Alzheimer's. If they drink too much, it might actually help to enhance the development of Alzheimer's. So it's interesting that all of these things are coming out now, but, for the past, 25 years, the whole tau protein issue, and more recently, discovering this molecule out of coffee bean has been done by Dr. Stock. So when Dr. Stock was doing his studies, he was using models of Parkinson's and Alzheimer's disease. He was able to show in animal models that there was an improvement when EHT was administered in animals, having symptomatology that was consistent with Parkinson's or Alzheimer's, and he was actually able to show in cell culture that when the EHT was applied to a damaged nerve cell, even to a nerve cell that was almost near death, he was almost able to restore it back to full health. So, those two things were significant in and of itself. Most people are going to, naturally question, well, where are the human studies that are involved in this? Well, there were some human studies, because in order to gain the full global patent, there had to be human studies to show that there was a significant improvement versus a placebo. And while the studies may not be readily available for all of us to see now, it certainly doesn't mean that they're not there. And as it pertains to the skincare, it took the company about 2 years before it released, its first study, which appeared in a dermatological journal. And I certainly believe that these studies are going to be released all in due time. But you have to be a little bit careful with studies in general. People do studies on things all of the time, and you can make a study look like anything that you want it to look. I mean, if there's a specific result that you're trying to get, it's very easy to manipulate that data. So some studies are reputable and some studies are not. Our company really tries hard to ensure that the studies that are put out are going to be reputable studies, things that are going to support, the science that they are promoting. And I also just like to mention to people in general that, studies only become important when they produce some sort of relevant change in what a physician will do. And those are certainly the studies that, I'm going to be most interested in. Are there going to be things that are going to force me to change what I do because it seems like something that's very relevant? And, I also, as a more common sense approach, just say, if I were to practice pediatrics exactly the way that the textbook told me to practice pediatrics, I wouldn't be a very good pediatrician. Life doesn't follow a textbook. The textbook is a guide, and many of these studies are guides that ultimately can, lead us to make a decision about what to do with things. So, I feel that the research that I found behind the EHT was very valid research. The journals were reputable in which he published. The science made sense. And just the notion of what it was able to potentially do for people was very exciting. So after having done the research on the mind enhancement supplement, then my wife and I started to take the product. And naturally, I knew that the very next question that most people were going to ask is, are your children taking it? So we had our 2 kids start taking it without any problems at all. I gradually dipped my toe in carefully and started offering it to college-age students and older adolescents, and they seemed to respond very well to it. And then after hearing a lot of anecdotal information and seeing information on Facebook about, people who had used the EHT in children and the success that they were seeing with it, I finally just decided that I was going to throw caution to the wind and start offering the EHT to some of the kids that I take care of with a variety of deficits. And it was interesting because around the same time that I had made the decision to do that, parents were coming in when I would do conferences, for their kids having problems with focus and attention, not really wanting their kids to be on stimulants. They didn't really like the side effects, and they really were looking for something that was more natural. And prior to the introduction of the mind enhancement supplement, I didn't really have anything that I could offer them. Most of the products that were on the market currently had a lot of caffeine or had an age restriction, and as a result of that, it just wasn't something that I was really comfortable with giving them. Plus, I didn't really feel like those things worked. If they did work, they would work for such a short period of time that it really wouldn't be beneficial in the long run. But then the supplement came along, and it sounded like it had, tremendous promise. So I finally just, swallowed hard and started offering it to people. And I'm really happy that I did, because the results that I've seen thus far have been pretty tremendous. So what does the supplement do? Well, it helps out with focus, attention, memory, concentration, organization, balance, and coordination. It also can help to support your immunity. It helps to enhance your natural energy stores, and it can help out with sleep, which is very important because improved sleep will also lead to an improvement in mood. It helps to improve focus. It helps to improve behavior. And your brain actually repairs itself, the most when a person is sleeping. And lastly, it can help to improve mood because the molecule itself looks like serotonin, and serotonin is a neurotransmitter that's actively involved in mood. So in pediatrics, I have found numerous uses for the mind enhancement supplement. Of course, the most common use are kids who have problems with focus, attention, memory, concentration, and organization. But I've also found that, some kids with behavioral issues, especially those issues that involve impulsive behaviors, seem to do a whole lot better. I have kids who have autism and Asperger's syndrome, and it's not really meant to specifically treat the syndrome, but it's meant to help with some of the symptoms, and that can be problems with focus, attention, or behavior, mood in those children. Kids with autism can't communicate well, so there's a frustration there. Also, there's some intellectual delay, so that becomes frustrating because they're not able to convey what they need to convey to people. And I've absolutely seen the frustration level of some of these kids decrease when the mind enhancement supplement was used. I have several kids with developmental disabilities that have improved using the mind enhancement supplement, and these are the kids that have really created a tremendous belief in me, because many of their conditions are static conditions, things that should never change. And when you're seeing things happen, you're seeing things changing, that becomes significant. Any change becomes significant because they should have never changed in the first place. And that has created a belief in me above and beyond anything else that I've honestly seen. And I've used it for kids with concussion and traumatic brain injury and some kids with chronic migraine. And while I'm sure that there are many other uses, time will dictate that. As I continue to talk with people, share about the product, I'm sure that there will be parents who ask questions about other specific things that it might be able to help with. And I wouldn't put anything past the supplement right now because of the great things that it's done with what I have used it for. I'm optimistic that it can also help with things that I haven't used it for quite yet. So the supplement contains vitamin B6 and B12, both of which are neurologically active, vitamin D, and the role of vitamin D in people is very important. It has a therapeutic use of vitamin D, and vitamin D is useful not only in tooth and bone health, but it's also very useful in neurological health and psychiatric health, and it is cardioprotective. It has magnesium and selenium, alpha-lipoic acid, which is a naturally derived brain substance, which helps with focus and memory, and then huperzine, which also helps out with memory. And huperzine is what we call an acetylcholinesterase inhibitor. Acetylcholine is a neurotransmitter in the brain that helps out with memory and helps out with concentration. And many of the Alzheimer's drugs, capitalize on modifying the acetylcholine, as the primary mechanism of treatment. So as you can see, it has all products which are naturally derived and all products that potentially can provide great benefit. The real blessing of the supplement itself is the fact that it doesn't have any side effects, and it doesn't really have any adverse interactions, at least any that I've seen reported with any other medicines. However, I do caution people when they're using it in conjunction with antidepressants because the molecule looks like serotonin, and many of the antidepressants prevent the breakdown and reuptake of serotonin. Sometimes too much serotonin can cause some issues, so I just want people to be cautious with that or talk with their doctor about it before making the decision to use the product, even though I have numerous people who have taken it in conjunction with an antidepressant never had a problem, but I think it's always better to be safe than sorry. I typically ask people to give the supplement about 2 weeks before they start to see some improvement and about 90 days until they get to the plateau. And that's because, like I said, the supplement looks like serotonin, the active molecule of EHT, and therefore it's going to follow the pattern of serotonin, which is about 2 weeks to improvement and 90 days until you reach your plateau. And, what I have been able to do with some of these kids is I've actually been able, for those who have problems with focus and attention, to stop their stimulant. And that's been a huge blessing for a lot of people because the stimulants have side effects and parents don't like the side effects that they have. And for those kids that have not been able to stop the stimulant, in many circumstances I've been able to decrease the dose of the stimulant to the point where the side effects are much less pervasive. And there are some kids who were taking, anti-anxiety medication or antidepressant medicine. Because of the positive impact on mood, I've actually been able to take some of them off of that or at least markedly reduce the dose. And ultimately for me, and I have about 90 patients, right now who are taking the supplement, it has really become a blessing. I never in a million years would have ever guessed that I would be promoting a supplement just because of how I was trained. But, it's so nice when sometimes notions are proven wrong, and I'm the first to admit that I was very highly skeptical of this product, and it took a lot for me to actually develop enough courage to start introducing it to people. But I am so thankful that I did because of the results that I've seen with some of these kids, and they truly have been life-changing, and they've also been life-changing for the families. I never dreamed that I would be able to help people in ways other than pharmaceutically or by counseling or whatever. And this is a way that I've been able to do that. And it's not only helped to improve the child, but it helps to improve the whole family dynamic because many of these conditions don't just affect the person. They affect the whole family. And I think for that reason, we have something very special. Furthermore, the product is an exclusive product to Nerium. We have an exclusive partnership with Signum Bioscience. So if somebody is interested in our product, we're the only means by which you're able to get that. And, parents feel so much better about using something like this because it's like a vitamin. It's not a controlled substance. It's not going to adversely impact their appetite. It won't adversely impact their mood. It's not going to, cause them to lose weight. It's not going to strip them of their personality. And that's really the key. People are worried that, stimulants will turn their children into zombies. And luckily, this will not happen. But I encourage people not to wait until, you have a deficit to use something like this. It's actually good for people, who have a healthy brain, who want to, continue to have a healthy brain, because I promise you, you're only given one brain, and when it's damaged beyond a certain point, it's not going to be subject to repair anymore. So, luckily for children have a greater ability to repair or at least develop alternate pathways, but adults generally don't have that. And, once you cross a certain threshold, there's no return. So I want people to just realize that you can take this as part of a normal, healthy routine just to help protect your brain and maybe to, delay the onset of some of these adult-type illnesses if there's a family history. And, along those lines, some of the things in the adult population that the mind enhancement has been used for has been Alzheimer's or Parkinson's, early onset, dementia. It has to be early into it and not, moderate or severe dementia. I don't really believe that the supplement would be able to, handle that. But for people with, early onset and, mild dementia, there has been some improvement. And that can be, improved. Dementia that's also related to MS or whatever condition. So dementia in general, or if there's a family history thereof, somebody might choose to take it simply because it might help to delay the onset in them, as that person would have a slightly higher risk. For traumatic brain injury and concussion, we've had people see pretty tremendous improvement even after they were told that they would likely not see any additional improvement. Stroke, people will develop deficits like in memory or balance or coordination from stroke, and certainly there could be other deficits as well. And we have seen improvement after people have started using the supplement for those things. And obviously there are going to be plenty of adults who have problems with focus and attention, and many adults are able to use the supplement exclusively, in the absence of the stimulant and function just fine. And that's a real tremendous blessing for them. And then there are people who develop a brain fog, whether it's from, chemotherapy or some autoimmune diseases like lupus, or hypothyroidism. They might just not be able to think very clearly. And, the way that they've described it to me is that the fog has just kind of lifted, and now they're able to think clearly and process things a whole lot better. And, both in the pediatric population and the adult population, there's a role in sports and athletics in that it can help an athlete focus and concentrate a whole lot better. It also helps to enhance recovery after exercise, and it was published in Muscle and Fitness magazine in December of 2015, talking about its role in helping to improve recovery after exercise. We're approved by the NFL, we're approved by the NBA, and we're approved by the NCAA as a non-performance enhancing drug. And, we have the BSCG certification, which indicates that, we are not a performance enhancing drug, so it's, appropriate to use in those venues. I would just encourage people, if the information that they hear on the call is not enough for them, do the research, look it up. We encourage you to do that. Ask questions, and if you feel the need, consult with your physician. Now, many physicians may not necessarily be aware of it or know how to counsel you, and honestly, I would just remind you that many of us are not trained, to use supplements, so you may not necessarily encounter a positive response, but ultimately, the decision to take the supplement is yours. And if you feel like the benefits would outweigh the risk, and really the risk is minimal, I would certainly encourage you to give it a try. You could do it basically risk-free. If you decide that after starting the supplement it's just not something for you, you could send it back within 30 days and get your money back. And also I would say, Nerium had, and I would be remiss if I didn't, Nerium has some other great products, including our night cream and our day cream. We also have our body contouring product, and we have our new under the eye serum. And Nerium provides a terrific business opportunity for people who might be interested in earning some extra money, getting some tax benefits, being a part of something that is potentially bigger than themselves and helping other people. So if you're interested, please talk to the person who asked you to join the call tonight. Again, I want to apologize for the previous call. That's just, a function of my naivete, and also, not really expecting that the call was going to attract so many people, for which I'm very, very grateful that people are interested in hearing what I have to say. For those of you who want to hear this replay, the number is going to be 1712-770-4019. The access code is going to be identical to the one that you used to dial in originally, which is 298-958#. Again, I want to say thank you for the opportunity to talk with you. I hope that the information that I presented to you has been useful information, and we certainly hope to either have you come on board as customers or potentially as brand partners if you see the vision in the company the way that we do. God bless you all and have a wonderful evening. Thanks again. Good night.